And our lunch guest is here, and thank you for being with us.
Thank you. Good to be here. When you asked me to come here today, I said, you bet. This is...
She did say that, actually.
I actually did.
It's true.
I actually did, because this is one that I don't understand many of the people in this room, and I don't understand the companies that you represent. You know, I'm here with a whole bunch of folks who represent, what did you all say in advertising this? The most influential, right? Come on, that's what it said.
I don't know, we have numbers.
People who, right, make the world go round, or whatever the phrase was. Where are you all on health care? I mean, let's face it, you could do this with dollars and cents. What's the cost that's climbing the fastest for probably every corporation represented in this room? It's health care. And the Republicans are sitting over there in secret, 13 of them, trying to figure out how to roll back health care coverage and, as part of that, roll back many of the reforms that were starting to drive down health care costs. That should matter a lot to people in this room, for your employees. And by the way, for any of you who have customers, it should matter a lot if your customers are going to lose health care coverage, if your customers are going to have the kind of minimalist coverage that says, yeah, you get this much covered with an out-of-pocket, and then once you get really sick, once you have a baby with a serious problem, you're just out of the consumer economy. There's no help left for you. And we're talking about not a handful of people. We're talking about tens of millions of people who will be affected. 1/6 of the entire U.S. economy. And most of the companies represented in this room have not had a word to say about that. Not had a word to say about a process in which 13 men are behind a locked door and they're horse trading over their political futures and how they're going to have to make health care come out. And they don't even want to put that bill out there where other Democrats and Republicans get to read it, where you get to read it, where experts get to read it, where families at home get to read it. You know, this is huge for American democracy, that somehow it has become okay on something as personal as health care, on something that is as big in the American economy as health care, and that you're all sitting silently by while 13 Republicans, man, they're going to do it. And the word is they're going to drop the old bill, let us debate it, meaning the House bill, jerk it up, put in the new bill after debate time is run and everybody votes and leaves town. That's not how law is supposed to be made in a democracy, and it's not how laws should be made. If you care about the survival of your employees, your customers, and this economy.
Yeah, but if that's what happens, is there a chance that a law this big could actually pass that way?
Yeah, are you kidding?
Well, I'm asking because there's some Republicans who are not happy with the process you just described either right now.
Yeah.
And they got to have every single one of them on board.
All I'm saying
right?
is Mitch McConnell sure is smiling while he's walking through the halls.
I'm not smiling at you, I'm guessing.
Well, that's true.